How does air pollution affect our health? Air pollution can have serious effects on our health. We know this because when air pollution is at its worst, some people can become so ill they need to go to hospital, and in extreme cases, air pollution can kill some vulnerable people. But for every person who dies or is admitted to hospital, many more need to visit a doctor, and more still suffer from asthma attacks or other symptoms that need medication. And even more suffer changes inside their bodies that they're not even aware of. But not everyone is affected by air pollution in the same way. Some are more vulnerable than others. People more likely to be badly affected by air pollution include the elderly, people with existing diseases, members of certain ethnic groups, asthmatics, babies, and unborn babies. The more normal levels of air pollution that most have experienced from time to time might cause us to cough or irritate our eyes, but being exposed to this pollution over and over again can cause some changes in our bodies that can lead to some of us becoming vulnerable in the future, either by slowing down the proper development of children's lungs or by making older people more prone to heart disease. But it is not obvious why air pollution should affect the heart. To understand this, we need to think about what happens when you take a breath of air. Each breath you take is full of thousands of particles, but what happens to them depends on how big or small the particles are. When you breathe in larger particles, like pollen, grains of sand, lumps of dust, the particles are likely to get stuck or captured before they go too far into the lung. They may get stuck in nose hairs or in snotty mucus or in your saliva. The walls of the windpipe, or trachea, are lined with tiny hairs called cilia, which work to trap particles and waft them back up the trachea to the throat, where they are then swallowed without us ever being aware of it. At the bottom of the trachea, it splits and splits again into ever narrower tubes. Larger particles can get no further, but smaller particles are better able to escape our natural defenses, fit through the thinner bronchial tube, and turn around sharp corners. Particles like smaller dust and sea crystals will make it as far as the bronchioles. The smallest particles, like soot ultrafine particles from burning fuels, can make it all the way to the base of the lungs, the alveoli. The difference in how far into the lungs particles can travel is why we use the terms PM10 and PM2.5, as only particles smaller than 2.5 microns can reach the alveoli. This is important because the alveoli is where oxygen is transferred to the bloodstream. There, the body will try to protect itself from the invading particles, but our defenses can be easily overloaded if we breathe in too many particles. This allows some particles to also get into the bloodstream and then invade every other part of the body. Over the past 3 decades, researchers have found that air pollution can cause or worsen a huge number of diseases affecting many parts of the body. The result of all of this is that, despite New Zealand having very clean air in most places for most of the year, we still have enough air pollution to lead to thousands of people getting ill and even dying earlier than they should every year.